Rehab is the first and so far the only clinic in this region that is concentrated on treating hair and scalp problems. We've been in operation in the last 1 year, 6 months. And we've brought together a team of experts. We have hair transplant surgeons, we have hair transplant technicians, and we have a trichologist, and then we have a plastic surgeon. These teams bring a synergy of if someone had a scar and to an extent that their skin is completely messed up, we bring in a plastic surgeon who repairs the scar, and then the hair transplant surgeons will proceed to do the procedure. However, the starting point is that if someone is losing hair or they have issues with their scalp, then the hair hub is a place where you meet the trichologist who will do the analysis, give the diagnosis of the particular condition, and then formulate a therapy or number of therapies that will be used to restore their hair or restore the condition that they're suffering from.
Refers to a surgical procedure that involves the movement of hair follicles from one part of the body to the other. The part of the body we move the hair from, we refer to it as the donor area. The area that we are moving the hair to is referred to as the recipient site. So it's a procedure done to manage hair loss of various types. The indications for hair transplant include one, male pattern baldness, also referred to as androgenic hair loss. This is the situation where due to somebody's genetic susceptibility, they start losing hair in a particular patterned way. There are specific parameters on the scalp that we do look at, and the hair loss will not extend beyond certain specific parameters. So it's referred to as male pattern baldness. The other form of hair loss that is very good for hair transplant is known as traction alopecia.
Traction alopecia is the most common experienced form of hair loss by African women, because this is as a result of pulling, where women will pull their hair to braids, to wigs, or wearing tight headbands, and that causes traction to the hairline, and definitely most of the African women are suffering from that. And we're seeing other conditions like autoimmune conditions, and autoimmune conditions are whereby your own white blood cells start attacking your hair follicles, because that is a genetically predisposed condition which requires something like stress of any kind to trigger the manifestation of that particular condition. Then we're also seeing a lot of fungal infection, and majorly this is because fungal form of hair loss is a very communicable condition or contagious condition. So people can pick it from salons, or kids can pick it from their friends in school, or it can even be acquired. I mean, someone can contact it from pets like dogs and cats.
Other indications include things like scars, either due to burns or due to surgical procedure or even road traffic accidents. So camouflage of those scars can be done using hair transplant.
Coming into the clinic, the trichologist does an analysis. Of course, there are many questions that we ask. If a patient has issues with deficiency, when we're taking them through the consultation form, then we will realize that we need to look for certain minerals or send them to do tests. If we suspect it's an autoimmune condition, then we work with pathologists to take biopsies and analyze and get a report. So the first thing is the patient comes in, we do an analysis, and then we get a diagnosis. And then that is what guides us to what form of treatment are we going to measure on. So some of the options that we have, for instance, patients who are suffering from genetic hair loss and traction hair loss that is severe, and they've significantly lost hair follicles, then that means we take them through hair transplant.
There are two main types of hair transplants that are available. The first one is known as the strip method of hair transplant, and the next one is known as the follicular unit extraction, in short FUE. Now, a hair transplant has gone through metamorphosis over the years. It started in the 1930s in Japan. There was a doctor known as Dr. Okuda, who was really the pioneer of hair transplant. And the methods that you were using then are not the methods that we use now. So slowly over time, the methods have changed so that we can now be able to have very natural results that are cosmetically acceptable to our clients. Strip method refers to the cutting of a strip of scalp at the back of the head in the area that we call the safe zone. And then that strip is dissected into individual hair follicles, and those are then transferred to the recipient site.
If patients are suffering from genetic or form of hair loss, that there is thinning of the hair, but the hair has not completely disappeared, then what happens is that we put them on other things that will trigger generation of more cells. Like we have a procedure that we call a PRP, or platelet-rich plasma, where we take up 40 mils of their blood and we spin it in a machine that is called a centrifuge, and we get the platelets, because platelets carry the growth factor, and that is what we inject in the place where their hair is thinning, because what we need is then to accelerate the hair growth, and if we inject the growth factor, then we get cell multiplication and the hair grows back. So we have a myriad of solutions. That those people will do laser, that those people will do laser hair, to help in hair generation. That those people will go in for transplants, that people will do PRP, that people will just do topical treatment, and then we will get their hair growing. But the array of treatments or solutions that we offer are guided by the diagnosis that we get when we do an analysis. Before we start any treatment, and that's why any patient must first go through the trichological trichoscopic analysis, because it's not the time to do guesswork. I mean, if a patient comes, we cannot start on a therapy unless we are so clear what condition it is, until we are very certain on the diagnosis, and that is when we formulate the treatment.
The procedures that we do when you're doing hair transplant, they're all done under what we call local anesthesia. So the client is fully awake, they are conscious, they can be doing something, they can be working on the computer or maybe doing something on the phone. The anesthesia that we apply on the scalp ensures that there is no pain felt at all during the procedure. When the procedure is done and the client goes home, there's some medications that we give just to prevent any headache or discomfort when they're at home immediately after the transplant. A normal transplant, the duration would be dependent on the number of follicles that we are transplanting. The various forms of hair loss manifest in various degrees of severity of hair loss. There is a specific scale of hair loss that we call the Norwood classification. So it goes all the way from Norwood 1 to Norwood 7. That indicates how severe the hair loss is. So if somebody is, for example, in Norwood 1 or Norwood 2, you're talking of about 1,000, 2,000 follicles, it takes a shorter period of time than somebody who would be going in probably for Norwood 5. However, in average, the procedure will take about 3 to 4 hours. Clients usually come in the morning. We start the procedure, we harvest the follicles, then we take a short lunch break, and on resuming, then we complete the procedure. And in the afternoon, the client goes home to rest for the evening. The transplanted hair will go through certain phases of growth. Immediately after the procedure, that is the first 3 days, the follicles are now establishing contact with the blood supply in the recipient site. Those 3 days are the most critical. because at this period, if the client is very aggressive, either in cleaning of the scalp, or you put on a hat and you remove it, you can actually lose those follicles. So those first 3 days are critical as the follicles anchor onto the recipient site. Immediately after that, the follicles start growing. However, there is a stage where the follicles will fall off, usually at about a month after the procedure. These hairs that had started growing fall off, and new hairs start growing in the second month. So after the second, third month, there's a lot of growth and the clients are happy. But at 6 months, this is a time where we usually tell our client, you are at 50% of the normal girth of how your hair is going to be. The full results are realized up to about a year after the procedure. So in terms of just coverage and the length and girth of the hair, at a year, that's the time they will not be able to differentiate between the place where we planted the hair and the normal or the other areas on the scalp.
If we put a patient on a particular treatment, it should not be beyond a certain period of time, because we have to do evaluation and see, are we progressing? And even if it takes putting this patient on trichoscopic analysis, again, to magnify the scalp and see, are we getting where we want to go? So we put you on a treatment for a certain period of time, and then we evaluate to ensure that the treatment that we're putting you on is working.
The complications that we like to mention to our clients about include one, the risk of bleeding, because this is a surgical procedure and sometimes there can be a bit of oozing of blood. And that is why before any of these procedures is done, there are certain tests that we usually do just to be sure that the patient's coagulation system is normal. And therefore, because it's a minimally invasive procedure, we would not expect much of bleeding. There are other risks like the risk of infection. And that's why we mitigate against that by ensuring that all our procedures are done under sterile conditions. And after the procedure is done, then the client is put on prophylactic antibiotics just to prevent any infection from setting in. Of course, the worst complication is failure of the hair to grow. And here probably there would be autoimmune conditions that would attack the hair follicles. And before we put any client on table for the hair transplant procedure, there are certain tests that we do usually by the trichologist to ensure that we are not dealing with a scarring form or an autoimmune form of hair loss that would result in failure of the hair follicles to grow. We have been lucky, or maybe it is just the professional way in which we've done our business, in that we've not had any patients getting infection and we've not had any troubles with bleeding. However, we've had 2 clients whose growth has been suboptimal, and after we experienced that, we tried to find out why is the growth not the way we would want it to be. And we did discover after doing some biopsies that these clients had some autoimmune conditions that messed up the hair follicles after growth. So that is just one of the things that we always watch out for, so that if you promise the client that you will have your set of hair in a year, then you should be able to deliver on that promise.
Trichology is a very new discipline in this region, and at Hair Hub what we're doing is we're ensuring that we get other trichologists trained, because one of the things is if we will grow, because we need to expand, we need to grow from Nairobi into other towns, into other countries, and if that is going to happen, then we need to have the right people in those new clinics giving the right diagnosis that we get the correct treatment. So what we've done with the team that we have, number one, I work with doctors and I work with the nurses who are certified nurses, because there are quite a number of surgical procedures that we do at Hair Hub. However, we've exposed our team to training. We are training a number of trichologists, and at the same time, any conference in the world that is talking about hair transplant, that is talking about stem cells, that is talking about PRP, we ensure that we send our relevant teams to do that. So we have to ensure that our teams keeps on updating what they are trained on, and we do this through sending them for conferences and enrolling other people into training in trichology to ensure that we remain relevant, and that our consumers of the consumers of our services really get the latest solution to the issues that they have. When you're a pioneer, you pave the way and people follow. And that is why we are involved a lot. Like, nobody has done hair transplant in this region. We were the first people to do follicular unit form of hair transplant. Nobody had used the PRP to regrow hair. We're the first people to use PRP to regrow hair, and correctly, to date, there is nobody else who is doing it. So we have quite a number of first. We are the first people to have a trichologist in this region, and we will continue updating ourselves. And that's why we have to, if it calls for traveling, if it calls for working with people who are doing research, we are involved heavily in research that is looking for stem cells. We have other things that are called air cells that we're really focusing on to ensure that we stay ahead of the pack in terms of giving solutions to hair loss and scalp problems. So the only way we can ensure that at Hair Hub that we are ahead of everybody is ensuring that we keep tabs with any research that comes out about hair loss and scalp issues, and any conferences that are releasing scientific studies that have been done recently, which we shall continue to do. We will invest to make sure that people working at Hair Hub have the latest information in regards to treating hair loss.